Leppin's going to be talking about chronic disease self-management.
Yeah.
Thank you.
Hi everyone. So my name is Leppin, and Sara Dick is here also, and then Nadia, you can come up too. I work in the Knowledge and Evaluation Research Unit, and we got a grant to work on a project, a community engaged research project to implement kind of a system for improving chronic disease and population health in southeast Minnesota. So I'm just going to kind of breeze through kind of some background about this, and then in the last bit we can talk a little bit about how to get your input on a web resource that Nadia is helping us build. So one of the things that we know from our research in chronic disease is that there are certain things that we can do for you here in the clinic, but there are a lot of things that you can do for yourself, and we're trying to figure out how to support patients and families in their self-management of their health conditions, how they can help themselves and also help one another is really the best way to take care of chronic health conditions. So this is an example of a evidence-based program that can be offered in the community setting. It's where individuals with chronic health conditions come together, and trained peer leaders, people that have chronic health conditions themselves, kind of guide individuals through 6 weekly sessions of a workshop. Some of you may be familiar with this kind of program. Some of you may have participated in some. They also have some for just diabetes self-management. We can imagine someone who's had diabetes for a long time, who understands how to live with it and the challenges that are involved, can kind of, they get together and they can kind of go over the process of what it's like to live with that and go through different self-management techniques and really equip one another with the tools that are required to live a healthy and meaningful life with a chronic health condition. So these are the kinds of things that are covered in this program. The one that we're focusing on right now is called the Chronic Disease Self-Management Program. Locally, it's called Living Well with Chronic Conditions. That's how it's branded through the Minnesota Department of Health and the Minnesota Board of Aging. And this is what it covers. Just general things that apply to anyone with any chronic health condition. So you can imagine whether it's arthritis, or diabetes, or cancer, or depression, or anxiety, these things are helpful. They really help anyone. I go through it, get a lot of it out of it every time. So this is kind of the aims of our research project, was just to partner with community stakeholders, and by community stakeholders we mean pretty much anyone. So we're working with public health, community agencies, other health systems in the region, to kind of conduct an assessment of barriers and facilitators to really getting this kind of program into routine primary care, and then engaging folks like you and other stakeholders across the region to develop a system. And I won't go into detail on this because I really want to give Nadia time to talk about where we're at right now. But we've had some meetings and kind of developed what's called the Southeast Minnesota Partnership for Community-Based Health Promotion. That's how we started it out, which the mission there and the vision are kind of listed. But I won't spend a whole lot of time on this. And we've trained some new leaders, and we're recruiting other leaders for these programs. We want to have, you can imagine, potentially a system where you go, it can be offered in a church or a community, a neighborhood association decides, hey, we want to do something for promote health in our area. We've even got people here in workplace units, employers. So we can really get this into the system in southeast Minnesota. And that's kind of what we're trying to get going right now. We're really working on the connecting the dots, the logistic coordination of how you get stakeholders that traditionally are very siloed to work together to create really an optimal system for population health. And we've been working with care coordinators throughout the Mayo Clinic Health System, really piloting efforts as they start referring to community agencies locally, whether it's here in Rochester or in Albert Lee or in Owatonna or Red Wing or wherever. And here's just some meetings that we've had. But this is where we're at right now, and I want Nadia maybe to come up and talk about, now we have this thing called Well Connect, that's what we've called it, Well Connect Southeast. We're developing a website and like Twitter and logo, and really want to develop an infrastructure where individuals across the community, Southeast Minnesota, can sign up for these programs, where clinicians can refer patients to these programs, and where everyone really gets excited about and is easy to find a way to access these programs and sign up for them, and potentially become leaders and be engaged in promoting that kind of idea. So I'm going to get out of this and let Nadia kind of take over. You just want to go to your... Is it live?
Yeah.
Obviously you do it.
So the website right now, we're still working on it. It's in really early phases, so I just want to set that context ahead of time.
Which is the best time for you to do it.
Yes, exactly. So the framework right now, there are a few things that we have laid out on the tool. So it's a website, but it's really a tool behind the scenes, because what you can do on it is you can search for workshops given your zip code. There are areas for providers and for leaders to go in and log in and manage these workshops, put some materials together for this workshop. Also look at the people who have signed up for these workshops. So having said that, that gives you guys a little bit of context there. So we've got our counter going on here, you know, so when you go to the web page, this is what it looks like. We have a little sneak peek here, preview. So like Dr. Leppin mentioned, that we're still building material. So this is going to be the home page, your landing page when you come to the website. This is going to be, this video right here is going to be a placeholder for getting testimonials, and we're working on recording those right now. So you can click on it, hear about the program, hear about other people talking about the program, how beneficial it is for them, and things like that. Then this is the area that we have been really working on our on this tool right now. So I can type in 55902, let's just say. Hit enter. So these are all the workshops that are available close to my zip code, and they're ordered in closest to you shows on the top, and then so on and so forth. Now you can click on this one, on this workshop. You could go in, you can read about it, you could look at the venue, you could look at the address, you can look at who is leading the workshop, and then so this is for demo purposes only. So I just wanted to demo here, so you could register online. Sally Soul 1478. Oops. You can provide your phone number if you want to. Those are not required fields. And then confirm enrollment. And then it shows you a confirmation. Behind the scenes, what's going to happen is that the leader is going to get an email that somebody registered for the workshop. The coordinators are going to get an email. And then the person who registered for it, if you provided your email address, you'll get a confirmation that you signed up for this. So now if I go back and look at that workshop again, there's Sally Soul. She just signed up. So that's all functional right now. there's a lot more that we need to add to this. There's a lot of resources, PDF resources, video resources that are going to be going on here. We've got placeholders for an area for providers where they can go manage these resources. It's just placeholders for workshop leaders and just about the program in general. So that's where we are so far. You can click on the email here. You can send an email. There's Twitter, Facebook, and some general information at the bottom.
So, just first impressions. Any thoughts? What would you want from? What would get you to sign up for a program like this, and what would be the best way to do it?
Well, I'd need more information. It said May 14th through April 14th through May 19th, 4:30 to 7. So if it's that much time, like what does that include? Is it just someone talking the whole time? I would want more of a description as to what it was. And it's $50. So what do I get from that $50? Besides the 2.5 hours every Thursday for a month, what does it entail? You know, is it one person that leads it, that does all the talking? Are there other people there, other professionals? Is it talking about diet, lifestyle? Is it everything, or is it just one person?
Right. So I think this is very, very early.
Yeah.
So what we're actually probably going to do is actually have a list for the different programs with a summary of each one, and then probably put that somewhere in the sign-up area too, so that when people are signing up, they actually make sure that they confirm, you get a sense of what you're actually signing up for.
And because it's at the Healthy Living Center, is it something where it would say dress casually, or is it something where you're going to have to exercise or walk around or do anything, or do you just kind of come
Attire.
Great.
So.
Yeah, Eric?
Well, a couple of things. First of all, a phone number would be useful for each one of them. Just as a general comment, Dan Abraham charges $50. A lot of the other ones charge $0. Basically, you could give a deposit to the textbook and return the textbook and get your money back. Or some of them, you return the textbook and then you don't owe the money. If you want to keep the textbook, it's $25. I've taken the course twice. I'm actually a little bit disappointed in it, to be fair, because I'm a type 2 diabetic, and I really was hoping to get sort of kind of like group support on that, and it just isn't the technical knowledge to do it. I'm a little, while I do like the idea of having this, I'm a little worried that this would distract from what I think is much more necessary component, which is to have support groups for arthritis, for asthma, and for diabetes, where people can get factual information from a trained group in the specific diseases. I found it very simplistic and almost at an elementary school level, and so I was a little worried if this is going to be focusing on something where we spend so much time on this, we don't do what I think is a much more critical area, which is to have support groups in areas of diabetes, asthma, and arthritis, and other chronic diseases where people can actually have real support in trying to get feedback on current problems that they're having. The people in this group just don't have the skill set to do that.
Yeah, I agree with that too, because for most of us, if we've lived with a chronic illness for 30, 40 years or whatever, you know, we're kind of the experts in it. And so, you know, if we're going to something where it's trying to teach us what we already know, then...
Right, and that's my concern.
You know,
I think we're the #1 department in the country on endocrinology, and we're one of the few cities that doesn't have a diabetes support group of any kind.
Yeah, we don't have a problem.
And I think that's a real problem. I'm just worried that this will distract from that, and that think they're doing this through the public health department, the counties, which I'm involved in too, and I just think that this is just not going to solve that function. And because what happens at the end...
There's different populations for whom there would be different...
Right, and what's concerned though is
yeah.
because at the end of this, when you ask them, like, where can I go for the others, it's like a dead end. And you're sort of siloed out into nothingness. And so there needs to be...
So where to go for extra...
Like if they do this, there needs to be a level 2 where you can specialize in your specific disease rather than
So that's like, we'll have a diabetes self-management program too. This is a general one that applies to pretty much
The
anyone.
diabetes self-management program is usually a one-time course that you take in endocrinology. I'm talking about an ongoing support group and an ongoing effort to do it, not a one-shot, time to say, once you take it, you finish it. I'm talking about something a little more steady, and that's what's needed, I think, both asthma and diabetes, arthritis. Other people should be trained as arthritis specialists in exercise and in how to manage your life and how to manage other aspects with different kinds of disabilities. And I don't think this does that, because again, you're training people with a very short course, and then they go in there, and they usually know, frankly, way less than a lot of the people in the class, and that's the problem.
Or maybe, maybe what you could do though is with these, if they're 4 weeks or something, maybe at the beginning or at the end, you could have like a panel of people with different patients with different kinds of illness. So whether it's diabetes, Crohn's, asthma, whatever, and people that they can specifically ask questions of, because sometimes, if patients are going to go to this and want to know how to manage it, they're going to feel most connected to another patient who's lived it, who has been through it, rather than people that can say, in general, you can do this, but.
This is running, though, with a structured program by Stanford, and it doesn't really, there's some talk about different illnesses, but it doesn't really allow for that. It's a very set curriculum. I just wish there was an ability to sort of mold it more to the specific diseases, as it progresses forward, but it doesn't really allow for that because it's so tightly bound about that textbook.
Okay.
So that's.
We need to spend most of our time really thinking about the infrastructure.
And the telephone, putting a telephone,
Okay.
I see it there right now,
Great.
but it wasn't really apparent initially.
Yep, yes.
Am I right that once you sign up then, and if I go back in after she signed up, I'm gonna see her name, phone number, and everything? I wouldn't like that.
No, that was just for demo purposes only.
Okay, so
I just wanted
It would
to.
not show me that you
No,
signed up.
no. This was that's why we specifically put there that once the design is complete, the list of participants will only be available to the workshop leaders and site administrators. So that was, I just wanted to show the functionalities that, here you're registering for it and it's showing up as one of the participants.
Will there be enough a login for users, they can do it, should they sign up for different things, that they can say, okay, once I log in, then I can go to like my homepage and say, these are the 3 things you sign up for, or.
Yep, yes. We're planning on providing that functionality.
What else? What about just the general, I go back to maybe the main page. So the appearance, what do you think? Do you like the colors? Do you like the layout or not?
Not the green.
The green is hard to see.
Okay.
I agree.
To me, you should have more about, it's connected to Mayo Clinic, right? And I think for people, if they see it's connected to Mayo Clinic, will need more, so I think it should show more. Or there should be a bigger, significant show that it's through Mayo Clinic, or Mayo Clinic is sponsoring it, or however it is.
Yeah, I think we'll have all the different partners somewhere. I'll have a place to show that.
Well, this isn't really sponsored by the Mayo Clinic, this is sponsored by the state, isn't it? And so the Mayo Clinic partners in it, but it's not really the Mayo Clinic initiative.
The goal of this is, if you can think about it, is actually to fix the healthcare system. So to not really spend any more money, but to get better health outcomes for the population. So it's really partnering everyone together that cares about improving the health of people in southeast Minnesota. So to say that it's just Mayo really gets rid of the value that you have from public health and community agencies, the government, and all of, you can imagine churches, you can imagine nonprofit organizations, you can imagine anyone that volunteers to help could have a role, but if it's just Mayo, then so Mayo supports this, and certainly we have Mayo employees and Mayo individuals that are going to help out, but that's not really, when you Mayo brand it, you kind of get away from that. Yep.
First, I want to say I think this is a great idea. I think anytime we can have like an official class or something where people can go to and learn from other people, I think is great, because doctors don't have a lot of time if you're newly diagnosed with diabetes to tell you everything you should know, and maybe you're not good on computers and you don't really understand, so I think it's great that there is a place that you can go and learn listening, someone teaching you about whatever new diagnosis you have, or maybe you've had it for 5 years and don't really know much about it.
Right. Yeah, and it's a little different, so kind of to various points,
It's not specific to an illness, it's more just overall general.
it's
Things you can do, like exercising, eating right.
things that improve, eating right, getting good sleep, how to communicate with your healthcare providers, how to manage your medications, how to do a lot of things, and then work on specific action plans during the week, so you actually help one another. I may be dealing with, maybe I have cancer, but the thing that's bothering me most right now is that I can't climb my stairs, and I need to exercise my, legs or something like that. And so I'm going to work on that this week, and you're going to call me about it, and we're going to help each other. And so that's what happens over the 6 weeks. It's everyone kind of is working on different things, but together. And so, yeah.
Is there any build-in so that, to me, that whatever the particular illness is, there's a need for us to be able to socialize and normalize with others the same?
Yep.
Is there anything built in there? I mean, I can listen to you tell me what to do, but you haven't lived it like I and this other person did.
Right.
And that's the biggest piece, for instance, for our coronary club, is the socialization and the normalization.
That's the whole point of it. That's why it's a group, and that's why the individuals that are trained to lead it also have chronic health conditions themselves, and they talk about that. But so, yeah, a lot of times the groups continue to meet together even after the thing is over, just because they've developed those relationships. But
And how do you get the speakers or the people that are doing this?
the leaders,
Yeah.
we train them, we recruit them, and a lot of times people that go through the program decide they want to be trained to be leaders, and so then it's a 4-day training, and then they go and lead their own. Yes?
Could you repeat the website? We're not sure we got it down right.
It's not really live yet, but
Yeah.
go ahead and.
You
It's
said
called,
that right at the front.
yeah.
Front. Sorry.
What's the timeline to activate it, you know?
So March 1st is the tentative. Given the feedback, I think we'll have to, yeah, so tentatively, right now, we're shooting for March 1st.
And how will we know about this? Will there be?
Yeah, so there'll be a whole probably PR thing, and then we'll start developing materials that your primary care clinicians will know about and all that kind of thing. But we want to have something before we actually roll it out.